together. Safe in my arms you'll be. I wish you the best of everything. You'll always be precious to me. You and me, baby, together.
Hello, my name is Maurice Meehan. I work for the Public Health Agency, and it has been my pleasure to have worked with a number of organisations, including National Children's Bureau Northern Ireland, to establish an infant mental health framework for Northern Ireland.
It's absolutely critical. What goes on in that kind of period has really critical implications in terms of later life outcomes, and that can be both positive and it also can be negative if there are very significant overexposure of prolonged unprocessable stress for 0 to 3s in that critical phase. So what does that mean? It means that we need to organise ourselves on the basis of understanding neuroscience and what will work in terms of assessment with families and intervention with families to support recovery and addressing where there are some attachment problems that can be addressed early by people having the knowledge and skills associated with assessment and work with families.
I'm Roberta Marshall and I'm Chair of the Association for Infant Mental Health in Northern Ireland. AMNI was established in 2009 and since then, with our membership, we have worked to raise awareness of infant mental health and the importance of the first 1001 days at all levels within Northern Ireland. More recently, we have welcomed the formation of the Stronger from the Start Alliance, a body of over 40 voluntary and community organisations who have joined us in calling on our local leaders for the needs of infants and their families to be addressed in policy, strategy and service delivery. One of our greatest achievements has been to have infants specifically mentioned within the mental health strategy for Northern Ireland.
I'm Magella Conley and I am the iCAMS team leader in the Southern Trust CAMS service. We provide intervention to babies and toddlers and their parents or carers in order to help grow and flourish that early relationship. In the Southern Trust, a few years ago, we launched our infant mental health strategy, Good Beginnings. Furthermore, in the Southern Trust, we sit on the Infant Mental Health Strategic Group and also the Perinatal Local Implementation Group. We look forward to also joining the Infant Mental Health Awareness Week this year in June.
ABC PIP is a specialist infant mental health team within the South Eastern Trust. Here is one of our mums talking about the difference attending the service has made to her and her baby.
Enjoyed our visit and it made us feel more relaxed. I had my third baby and there was quite an age gap, so it made me feel that I had forgot a few things, but just knowing that I had somebody come out to help and support was really, really reassuring.
Home starts in Newry, Banbridge and Armagh and Dungannon areas, along with the Parenting Partnership in the Southern Trust area, have secured funding from the Public Health Agency through our local CDIC to support a parent infant programme suite. The programme has been offered in response to identified need expressed by new parents in the Southern Trust who have particularly been affected with a sense of isolation and a loss of natural support because of the COVID and its impact.
Hiya, I'm Joanne and this is Baby Lorcan. I've found it really good to be able to get out of the house, especially in days that are cold and maybe it can be a long day in the house on your own. So it's good to get to meet other people and for the babies to mix as well.
The focus of the Northern Health and Social Care Trust Infant Mental Health Strategy has been about getting back to basics. This has included raising awareness of the importance of positive infant mental health and strong parent-infant relationships. As well as training and education of all of our staff, the Trust has provided services that has encouraged and supported parents to engage meaningfully with their children through books, talking, touch and singing.
Ready? Yes! You ready? 1, 2, 3, 4, 5, 6, 7. Where did 8 go?
The connection between a baby and their caregiver is the main way a baby's brain develops. Brains develop when the caregiver's response to their baby is contingent, warm, and prompt. From birth and throughout the early years, speech and language therapists have a significant role in supporting the quality of these developing relationships, building a strong foundation for positive mental health and all future development.
When Dad smiles, Caitlin smiles back. Dad's love makes her feel safe. She is calm, content, and ready to chat.
How much of that hand are you going to fit in there?
Family Nurse Partnership is grounded in attachment theory. From the first contact with our young parents, it's threaded throughout the 2.5-year programme. We promote that important connection with their baby during pregnancy. By talking, singing and reading to the bump, our parents notice their baby's patterns and responses before birth, building that important link between the womb and the outside world. In FNP, we dispel any myths about parenting and help our parents to understand their own baby's cues, encouraging them to baby watch with the aim of keeping their baby in mind.
Tiny Start sets out to deliver a home and community-based project with an emphasis on holistic child development and unique practical family support to parents of premature infants.
Tiny Start was a brilliant opportunity, an amazing opportunity for us, and we were getting a professional coming into our house to check up and give us advice, talking us through all the little exercises that we would have to do and games that we could play with Connor to encourage him to develop the parts that he needed to do for that stage. And it was very reassuring and gave us confidence that Connor was his development was going in the right direction.
Hello, my name is Deirdre Mahan. I'm a child and adolescent psychotherapist, and I'm also the local course organiser for M9. It's a Tavistock course delivered locally, and it's entitled Perinatal and Early Years Work, a psychoanalytic observational approach. This course is highly relevant for those working in early years. Close and detailed observation of infants provides a kind of direct experience of how minds grow from early years. So babies are observed with their parents, with their siblings, in a natural environment, and students report how rich a learning that is, that what they observe in this close detail is something that is unique in their experience. Health visitors, social workers, Your Start workers all report the richness of that learning. I would encourage you to have a look at the Tavistock website for the course, which will provide you with more detail.
You and me, baby, together, safe in my arms you'll be. I wish you the best of everything. You'll always be precious to me.